Very much for that warm welcome, Rosanna, but can I start by thanking you, Dagan, for your presentation and for thanking you for all the work you do as a junior doctor, to thank all the junior doctors and to make this commitment today that I, as a health secretary, will never pick unnecessary fights with junior doctors, will never abuse junior doctors. I will work with junior doctors to deliver the best standards of patient care this country has ever seen. And Rosanna, what an introduction. And since you came into Parliament in the last year or so, you have been an absolute whirlwind, a brilliant fighter for the people of Tooting. When this Conservative government wants to cut the NHS here in Tooting, you are there fighting for the NHS in Tooting. When this Conservative government wants to cut schools here in Wandsworth, you are there fighting for schools in your constituency. When this Conservative government wants to run an economy so that people are worse off, increasingly reliant on zero-hours contracts and temporary work, you are there fighting for them in the House of Commons. And what we need here in Tooting is you re-elected in Tooting in a few weeks' time. So I wanted to come along to talk to you this morning about our plans for the National Health Service and to outline our plans for a new deal for patients. But you'll have seen that the NHS has been in the media quite a bit this last weekend with this cyber security scandal. Well, hasn't the government's response been utterly chaotic? Yeah. We have a health secretary in hiding. No one's seen him. You're more likely to see Shergar than see the current health secretary. That was a racehorse that went missing for some of the younger members of the audience. We have a home secretary utterly complacent and a prime minister utterly dismissive of the needs of the NHS. And I'm not surprised the Health Secretary is on the run, hiding away, trying to run away from his record as the Health Secretary. Because when you look at what has happened to the IT budgets in the NHS, the capital infrastructure budgets have been cut. The NAO, the independent experts at the NAO, published a report recently which showed $1 billion has been taken out of infrastructure budgets and had to be transferred to the day-to-day running of the NHS to help the NHS itself balance its books. That's £1 billion that could have been spent on the infrastructure of our NHS, including upgrading our IT systems. So I'm not surprised that the Health Secretary is running away from his record on the NHS. And just here in this part of London, just a few days ago, St George's warned in the minutes from their trust meeting that because of the underinvestment in the infrastructure, that a cyber security attack was a risk. And indeed, in the last few days, this weekend, I understand that St George's has been on alert, taking patients from other parts of London because of this cyber security scandal we've seen unfolding. Today, across the country, we're getting reports that it's affecting GP surgeries. So let me say this. The government should now publish the Department of Health's risk register so we can all see whether the government were prepared for this cyber security attack, whether they understood the implications of their spending cuts. But I also want to say something else. Because you know the NHS has been going through the biggest financial squeeze in its history under these Tories. You know, head for head, next year the NHS will be cut. £1 billion was taken out last year from infrastructure budgets. Billions is planned to be taken out again from infrastructure budgets by 2020. Well, this isn't good enough. So my first announcement here today is to say to you that a Labour government will put the investment into the infrastructure our NHS needs. We'll put £10 billion into the infrastructure of the NHS. And some of that, yes, will go to upgrading and securing our IT systems in the NHS as well. So it's a pleasure to be here with Rosanna, a junior doctor, and to talk to you. Because next year is the 70th birthday of the National Health Service. And it wasn't the creation of the National Health Service, one of the greatest creations of a Labour government. Created based on enduring, unshakable principles, free at the point of need, irrespective of wealth, there for everyone when you need it. And yet, on its 70th birthday next year, under these Conservatives, waiting lists climbing towards 4 million, and we've seen from leaked documents from NHS bosses, could rise as high as 5 million under the Tories. 2.5 million people last year waiting beyond 4 hours in A&E departments. 26,000 people waiting beyond 2 months for cancer treatment under the Tories. And next year, if the Conservatives are re-elected, in this country, head for head, the money going into the NHS will be cut again. So, on the eve of the NHS's 70th birthday, let's give the NHS a birthday present. I'm announcing today that a Labour government will put over £30 billion extra over the next 5 years into our National Health Service. And that money will go into reducing the waiting list. So whereas waiting lists could rise by 1 million under the Tories, under Labour we're going to decrease the waiting list by 1 million. And also, in our A&E departments, 2.5 million people last year, as I said, waited beyond 4 hours. This extra investment will ensure that we treat 1 million extra people in our A&E departments across the country. And on cancer times, 26,000 people waiting beyond 2 months for cancer treatment. It's a disgrace. It's not good enough. So our extra investment will allow us to introduce a new target for the majority of people with cancer will get their treatment not within 2 months, but within 4 weeks under a Labour government. But I want to go further as well, because I think with this scale of funding, we can do a lot more in our National Health Service. Many of you will have seen the reports in the news about so-called delayed discharge. This is where elderly people are often literally trapped in hospitals with nowhere to go because there isn't the appropriate provision in the community, isn't the appropriate care packages, as we call it, across the NHS. It's not good enough. The way we're treating our elderly people is shameful. So with this extra investment, I'll be asking the NHS to work with us to introduce a new target for delayed discharge. Elderly people trapped in hospitals should be a thing of the past. If an elderly person is available for discharge, we'll ensure the community care is there, and we'll have a new target that we want 80% of people discharged from hospital within a week where there is a care package appropriate. That is the difference between Labour and the Tories on the NHS. And there was, you can clap if you want. And also, because we're putting this money in and we want to reform the NHS, I think we can go further on A&E as well. So again, we will work with the NHS to have a new target for our A&E department. The most serious people who present at A&E, with the most serious conditions, we will work with NHS clinicians and others to put in place a special target so people with the most serious of conditions and the most urgent of conditions can be treated within 1 hour in our hospitals. Again, that's the difference between Labour and the Tories on the NHS. But I have some further announcements. Because with this level of funding that we are putting into the NHS, I think we can do even more. So I, as the Shadow Health Secretary, have already announced that I want us as a country to have the healthiest children in the world. When you look at the league tables for child health, from obesity to asthma to dental health and all the various indicators, we are far too low down the international comparators. So we will put money into improving child health as well. And I've got something else to tell you. You'll have seen reports, as Rosanna said, of nurses literally turning up at food banks on the way home from work. It is shameful. So a Labour government will get rid of the pay cap and will give our nurses, midwives and everyone who works in the NHS a fair pay rise as well. But as Rosanna said, we've just come out of possibly one of the worst winters for 20 years. Some people called it a humanitarian crisis. Some people said the NHS was like being on a burning platform. We've heard stories of ambulances backed up. We've heard stories of people waiting hours upon hours and hours on trolleys in corridors. We now talk of corridor care in the NHS. Some hospitals have even put buzzers in the hospital, in the corridors, to treat the patients. We all heard stories this winter. Many people got in touch with me. A woman got in touch with me saying she'd been waiting 9 months for a knee replacement. She was about to go in, and then she got a phone call cancelling the operation. Or another woman who got in touch with me via email, who said that she had a secondary tumour in her stomach. She was a mother of 4, and her operation had just been cancelled. I mean, this was the NHS this winter. Things were so bad that the gymnasium in the hospital in Jeremy Hunt's constituency got turned into a ward. And yet, when all this was going on, all these operations cancelled, all these people waiting on trolleys, Theresa May and the Tories said it was nothing more than a small number of incidents. We should call it what it actually was, a badge of shame for this country. And I can announce today that I never ever want to see a winter like that again. So as part of the funding we are allocating to the NHS today, we will allocate a £500 million fund for winter in our NHS, so we never have a winter like the winter we've just had this year in the NHS. The reason I'm making these announcements is because we as a Labour government will always put patients first. And we as a Labour government, and I as the Health Secretary, will always take responsibility for the NHS. Never running scared, never vanishing, always out there, speaking out, making the case on behalf of our patients. And when you look at the history of our party, we are a party who has always taken responsibility for the NHS. In fact, one of my favourite poets, W.B. Yeats, always wrote, "In dreams begin responsibilities." And we as a party dreamt of an NHS free at the point of use, available to all, irrespective of means, and we took responsibility to bring it about. Throughout our history as a party, we have always stepped in to give the NHS what it needs, to rebuild it through times when it has been pushed back, because we take responsibility. I will take responsibility. And the choice in this election is now absolutely clear. It's either a fair pay rise for our NHS staff with Labour, or poverty pay with the Tories. It's investment in our NHS with Labour, or cuts to our NHS with the Tories. It's 1 million off the waiting list with Labour, or 1 million added to the waiting list with the Tories. This election is about the future of the NHS. Let's get out there, let's make the argument, and let's win it for the patients who deserve so much better. Thank you very much.